What if I told you we could stop a disease before it even has a chance to start? I mean, it sounds simple, right? But that idea is probably the single most powerful weapon we have in public health. So today we're going to dive into the three core strategies that epidemiologists use to make that happen. We call them the pillars of prevention.
Yeah, so how do you do that? How do you stop something that hasn't even happened yet? And no, this isn't some kind of science fiction movie plot. This is the central question that drives pretty much all of public health. It's all about shifting our mindset from just reacting to sickness to proactively protecting our health from the get-go. Okay, to make this super clear, let's think about it like fire safety. It's an analogy that works perfectly. First, you do everything you can to prevent a fire in the first place, right? You use fire-retardant materials, you're careful with wiring, but if a fire does start, you have a smoke detector to catch it early. And if it gets out of control, well, that's when you call the fire department to manage the situation and control the damage. See? Prevention, early detection, and damage control. Those three steps are exactly how we're going to look at preventing disease. All right, let's start with pillar number 1, primary prevention. This is all about stopping trouble before it even starts. In our fire analogy, this is that fire retardant wall. It's our absolute first and strongest line of defense. And look, the ambition here it's huge. We're not just talking about treating sickness. The whole point is to prevent it from ever happening at all. This is about building a giant shield, basically, to protect entire populations. And this is really where epidemiology can make its most massive impact. So what does this actually look like in the real world? Well, the goal is to get rid of the risk factors completely. Think about something as basic as improving sanitation to remove dangerous germs. The really key thing here is that this is aimed at healthy people to keep them healthy. And the examples, you see them every day. Vaccinations, campaigns to get people to stop smoking, even laws that make us wear seatbelts. But of course, that first line of defense isn't always foolproof. So what happens if something gets through? Well, that brings us to pillar number 2, secondary prevention. The motto here is simple: catch it early. Back to our fire analogy, this is the moment the smoke detector starts blaring. The fire has started, but we've got an early warning. Now, the key thing to understand here is that the disease might have already started. We've missed that first window for primary prevention. But, and this is a big but, we can still catch it early, slow it way down, and hopefully stop it from doing any real damage. You know, this is the world of your routine medical checkups. The whole focus is on finding a disease while it's still hiding, basically. We're targeting people who might have it but don't feel sick yet. They're asymptomatic. You've definitely heard of these: cancer screenings like mammograms, simple blood pressure checks, or those routine blood tests that can flag a problem way before you'd ever notice it yourself. Okay, so finally, what happens when the fire is really going, when it's too late for the smoke detector? That brings us to our third and final pillar, tertiary prevention. And this one is all about managing the aftermath. The fire department has arrived, and the mission now is damage control. At this stage, a disease isn't just starting, it's fully established. A lot of the time, this is where chronic conditions live. And so the goal has to shift completely. The focus is no longer on stopping it, but on reducing its long-term impact. We're not always looking for a cure here. We're looking for ways to manage the symptoms and, most importantly, improve a person's quality of life. And this is such a critical part of modern healthcare. The main goal is to improve someone's day-to-day life and reduce any disability for people who are already living with an illness. Think about rehabilitation programs for someone who's had a stroke, or those detailed management plans for people with diabetes, or even support groups that help people cope with the mental and emotional side of a chronic condition. Okay, so that's all the theory. But how does this all work together in the real world? Let's make this super concrete by walking through a case study. We're going to use tuberculosis, or TB. So let's break it down. Step 1, primary prevention. A perfectly healthy child gets the BCG vaccine. Why? To prevent them from getting a TB infection in the first place. Simple. Step 2, secondary prevention. Someone who's at risk gets a skin test. This is to screen for TB while it's still latent before they show any symptoms. And finally, step 3, tertiary prevention. A patient who now has active TB gets medication and therapy. The goal? To manage their disease and, crucially, to stop it from spreading to others. And the amazing thing is, this framework applies to pretty much any health issue you can think of. A flu shot to stop you from getting sick? That's primary. A mammogram to catch breast cancer super early? Secondary. And cardiac rehab for someone who's had a heart attack to prevent another one? You got it, that's tertiary. It's just an incredibly powerful and flexible way to think about health. So,
we've gone through this really powerful public health framework. But I want to leave you with a question. Now that you understand this three-step model, where else in your own life could it apply? Seriously, think about it. What about your finances, your career, even your relationships? This way of thinking, prevention, early detection, and management, it goes so far beyond just medicine.
All right, and that's our breakdown of the 3 pillars of prevention. Hey, if you found this explainer useful, the absolute best way to support what we do is to hit that like button and subscribe. We really do read all of your comments, so please let us know what topic you want us to break down next. Thanks so much for tuning in.